السلام عليكم ورحمة الله وبركاته. Good morning, everybody. Today we are talking about extraoral examination, a systematic clinical approach to evaluating facial structures, lymph nodes, TMG, muscles, and salivary glands in the dental patient. Definition and purpose. What is extraoral examination? Comprehensive clinical assessment of all structures outside the oral cavity, including the face, head, neck, lymph nodes, temporomandibular joint, muscles of mastication, and salivary glands, performed before any intraoral procedure. Why it matters? Extraoral examination often reveals systematic and systemic conditions, infections, or pathologies that patients may not report voluntarily. It establishes the clinical baseline before treatment, detects pathology outside the mouth, tumors, infections, swelling, identifies TMJ disorders, and myofascial pain dysfunction, reveals lymphadenopathy, including inflammation or malignancy, establishes baseline asymmetry, scars, or congenital anomalies, builds rapport, and reduces patients' anxiety during examination. Systematic sequence. A consistent order ensures no region is missed. Inspection always precedes palpation. Firstly, inspection, visual assessment of face, symmetry, skin, eyes, lips, and neck, at rest and during function. Alhamdulillah. Palpation. Bimanual examination of lymph nodes, TMG, muscles, salivary glands, and bony structures. Thirdly, auscultation. Listening to TMG for clicks, crepitation, cryptis, or grunting sounds during opening and closing the mouth. And fourthly, percussion. Tenderness, listing of bony structures and sinuses when sinus involvement is suspected. Clinical peer, always inspect before palpating. Palpation may alter tissue texture, swelling, or tenderness, and bias later findings. Step 1. Visual inspection. Observe the patient seated right, facing you in good lighting. Note the face at rest, then during movement. Facial symmetry. Compare left and right halves, not deviation, swelling, or paralysis. Skin and color. Pallor, cyanosis, jaundice, pigmentation, lesions, or scars. Eyes, lips, and nose. Eyelid droop, pupil size, lip competence, nasal discharge, or deviation. Step lymph node examination. Bilateral palpation from head down to clavicle. Use finger pads in a circular motion with light, then firm pressure. Notes to palpate. Submental, submandibular, preauricular, postauricular, occipital, superficial cervical, and deep cervical chain. Document size in millimeter, tenderness, mobility or fixation, consistency, soft, firm or hard, surface, smooth or irregular, borders, defined or ill-defined. AMG examination. Place finger tips pre-tragus in external auditory meatus. Assess joint during opening, closing, and lateral excursions. Normal findings: smooth, symmetric movement, opening from 35 to 55 millimeter, lateral excursion from 7 to 12 millimeter, with no pain or sounds. Abnormal findings: clicking, disc displacement, cryptus, osteoarthritis, deviation or deflection on opening, limited range, tenderness. Muscles of mastication. Palpate bilaterally for tenderness, hypertrophy, or trigger points, typically while patient clenches teeth. Extraoral muscles, masseter, angle of the mandible, temporalis, above zygomatic arch, medial tragoid, medial ramus, intraorally, lateral tragoid, inaccessible directly, accessory muscles, sternocleidomastoid muscle, trapezius, suprahyoid muscles, infrahyoid muscles. Salivary gland. Bimanual palpation of major salivary glands. Observe extensors and portents ducts for flow and saliva quality. Parotid. Palpate pre-auriculary duct opening opposite upper second molar. Submandibular. Bimanually, palpation below mandible. Duct opening at sublingual barnacle. Sublingual. Intraoral palpation in floor of the mouth. Multiple short ducts. Red flags: swelling, tenderness, pus from duct, dry mouth, xerostomia or firm irregular enlargement, suggestive of neoplasm. Step 6. Documentation. Record all findings, normal and abnormal, using standardized dental chart notation. Objective documentation is medico-legally essential. Use diagrammatic charts with face, neck outlines. Mark node size in millimeter with arrows to location. Describe TMG sounds as click, pop, riptus. Quantify mouth opening and lateral movements. Note any referrals made ENT, oral surgery, neurology. Date and sign every entry. Review at recall visits. What findings mean? Tender mobile nodes, visually reactive, indicates recent dental infection, viral, URI, or post-operative inflammation. Typically resolves once the primary source is treated. Hard fixed nodes, suspicious for malignancy, requires urgent referral to oral and maxillofacial surgery for biopsy, imaging, and staging workup. TMG click without pain. Common benign findings. Disc displacement with reduction. Reassure the patient. Treat only if symptoms progress or pain develops. Muscle tenderness on palpation. Suggests myofascial pain dysfunction, bruxism, or chronic parafunction. Managed with occlusal splints, physiotherapy, and stress reduction. Salivary gland swelling. Recurrent swelling on eating suggests obstruction, cyanosis. Persistent patient painless enlargement. Warrants imaging to exclude neoplasm. Remember, symmetric findings, persistent lymphadenopathy, more than 2 weeks, unexplained swelling, or progressive TMG dysfunction always warrant further investigation. Never dismiss on first visit. Key takeaways. A thorough extraoral examination is the foundation of comprehensive patient assessment, performed in under 7 minutes. It yields diagnostic information that often guides the entire treatment plan. Always be systematic: inspection, palpation, auscultation, percussion. Always be bilateral diagnosis. Compare both sides for every structure. Always be document all the results. Use diagrams, measurements, and clinical notes. The mouth reflects the body. Examine beyond the teeth. Every dental visit begins with the face, neck, and head, not the oral cavity. Thank you for everybody listening to our lecture today. I hope you are be happy to listening my lecture, and please give your share, like, and subscribe in my channel. دكتور مفيدة, and thank you. السلام عليكم ورحمة الله وبركاته.